Good morning to you all. Today we are going to discuss about the surface anatomy of abdomen and pelvis. Okay, today we are going to discuss about the surface anatomy of abdomen and pelvis. First, see, this is the anterior abdominal wall. This is the anterior abdominal wall. First, what is surface anatomy? Surface anatomy is nothing but it is also a branch of the gross anatomy. It is also a branch of the gross anatomy. It deals with the study of structure. It deals with the position of the structure, whereas the organ. It deals with the position of the structure and organ of the body, where we should draw the structure for the general outline. Okay, draw the structure general outline on the surface of the body. Okay, it deals with the study of the position and different organs. Study of the position of different organs and structures by drawing general outline on the surface of the body. Okay, this is about the surface anatomy. It is useful for the general outline of the different organs and structures which will drawn outline on the surface of the body. Okay. Next, it is important we should know why we should know about the surface markings. It will be useful for the anatomists, whereas it will be useful for the clinicians, whereas also it is useful for the surgeons, where we should give incisions like that. It is will be useful. Okay. Next, some important landmarks are used by knowing visibly or by palpably. Okay, see, this is the anterior abdominal wall. We all know about this points. Okay, what is this point? This point is the xiphoid process. Okay, this is the xiphoid process. Xiphoid process is a part of the sternum. Sternum consists of three parts: sternum, body of mandible sternum, body of the sternum, and xiphoid process. This is the xiphoid process. Okay, this is the number one point is the xiphoid process of the sternum. And next, these two are the costal margins, right and left costal margins. These costal margins are formed by the costal cartilages. Costal margins are formed by the costal cartilages. Okay, these number two, these are the costal margins. Okay, and next number three, this is the three. It is the common side. Okay, this is the main side. The tip of the ninth costal cartilage. Okay, this is the site for the tip of the ninth costal cartilage. Okay, and next, this is the intertendinous sections. Intertendinous sections, where you had seen the intertendinous sections in the rectus abdominis muscle. It will show some parts. Okay, this rectus abdominis muscle will be divided into 3 to 4 strips. Okay. 3 to 4 parts by these intertendinous intersections. Okay, these intertendinous intersections are formed by the aponeurosis. Okay, it is formed by the aponeurosis. By this intertendinous section, this rectus abdominis muscle will be looks into a pans. Okay. Next, umbilicus. This is the umbilicus. Okay, this will be visible via eyes. Okay, this will be visible by a naked eye. Okay. Next, iliac thrust. This is the iliac thrust, where you are going to see the iliac thrust in the hip bone. Okay, in between the anterior superior iliac spine to posterior superior iliac spine, entire extent from anterior superior iliac spine to posterior superior iliac spine, you are going to see the iliac thrust. Next, I will show you in the next figure. Okay. Next, number 7, anterior superior iliac spine. This is the site for the anterior superior iliac spine. Where you are going to see the anterior superior iliac spine? At the iliac. Okay, expanded plate of the iliac. Anterior most part of the iliac is called as a anterior superior iliac spine. Okay, here you are going to feel. You can feel in your body. It is palpable. Okay, it is palpable in your bodies. Okay, it is a bony landmark. And next, linea semilunaris. Linea semilunaris. This is the linea semilunaris. Okay, it will be extends from the pubic tubercle. It will be extends from the pubic tubercle to tip of the ninth costal cartilage. cartilages. Okay, this linea semilunaris, which will be formed by the lateral border of the rectus abdominis muscle. Okay, this is the linea semilunaris. And next, linea alba. This is the linea alba. Okay, how this linea alba is formed, we will discuss in the next slides. Okay, next, inguinal ligament. Okay, where it will be attaches, it will be, this is the inguinal ligament. Where it will be attaches, it will be attached to the anterior superior iliac spine to pubic tubercle. Okay, this is the site where the inguinal ligament is present. Okay, next, pubic tubercle. This is the pubic tubercle, and next this is the pubic crest, and this is the pubic symphysis. Okay, these are the important landmarks for in the anterior abdominal wall. We should know about these structures where this xiphoid process, coastal margins, whereas tip of the ninth coastal cartilage, linea alba, semilunaris, anterior superior spine, inguinal ligament, pubic tubercle, pubic crest. All these things we should know while reading the abdomen. Okay. First, coming to the boundaries of the abdomen. Okay, it is bounded superiorly or above. It is bounded by the diaphragm. Already we had seen in the section. Okay, above it is bounded by the diaphragm. Below it is bounded by the iliac crest. See, this is the iliac crest. Okay, this is the anterior superior iliac spine. Okay, this is the inguinal ligament. And next, this is the pubic tubercle. This is the pubic crest and pubic symphysis. Okay, all these things we will discuss in the next slides. Okay, in details. Next, umbilicus. What is umbilicus? Umbilicus will be where it is present. It is present in the midline. It is present in the median line or midline. Okay, it is present in a median line junction between the tip of the xiphoid process to pubic symphysis. Okay, where it is present junction between the tip of the xiphoid process to pubic symphysis. See, it will be lies in the junction between the tip of the xiphoid process to pubic symphysis in the median plane. Okay, what is the other name for the umbilicus? It is also called as a navel. It is also called as a navel, or also called as a belly button. It is also called as a belly button. Umbilicus is nothing but it is a hollow or deep depression will be seen in the anterior abdominal wall. Okay, at which level it will be lies? It will be lies at the level of junction between the L3 and L4 intervertebral disc. Okay, L3 and L4 intervertebral disc. Okay, at which location it will be present? It is present at the junction between the L3 and L4 levels. Okay, in the normal adult. Whereas in children it will be lies at the lower level, whereas in obese person it will be lies at the higher level. Okay, whereas in normal adult person, in living persons, it will be lies at the level of junction between L3 and L4 vertebra, intervertebral disc, or between L3 and L4 vertebra. Okay, these are the boundaries. Above it is bounded by the diaphragm. Below it will be bounded by the iliac crest, anterior superior iliac spine, and inguinal ligament, pubic tubercle, pubic crest, and pubic symphysis. Okay, these are the boundaries for the abdomen. See here, costal margins are very prominent here. These are the ribs and these are the costal cartilages. Okay, this is a costal margin. Costal margin is formed by the fusion of these costal cartilages. Okay, this is the right costal margin, whereas this is the left costal margin. This is the tip of the ninth costal cartilage. Okay, this is the tip of the ninth costal cartilage, whereas this is the tip of the 10th costal cartilage. This is the tip for the 10th costal cartilages. Okay. Next, coming to the linea alba. Already we had seen in the previous slides. What is linea alba? Linea alba is nothing but it is a fibrous raphe. It is a fibrous raphe which will be extends from tip of the xiphoid process to pubic symphysis. Okay. What is linea alba? Linea alba is nothing but it is a fibrous raphe which will be lies in a linear depression. It is a linear depression in the median plane. Okay, it is a fibrous raphe where it is present. It is present as a linear depression in the median plane. Okay, which will be extends from the xiphoid process, tip of the xiphoid process to upper surface of the pubic symphysis. This is the extension of the linea alba. Okay. Next, how it is formed? It is formed by the fusion of the aponeurosis of anterior abdominal muscles. Already we had seen this linea alba in the abdomen dissection. Okay, where you had seen it will be seen in the anterior abdominal wall extends between the tip of the xiphoid process to upper surface of the pubic symphysis. Okay, how it is formed? It is formed by the fusion of the anterior abdominal muscles. Okay, we know all the anterior abdominal muscles means external oblique, internal oblique, transverse abdominal muscles. These muscles fuse together and forms a graft. This is a fibrous graft. Okay, where it is present in the median plane. Okay, in the anterior abdominal wall. Okay, it consists of this linea alba consists of a connective tissue. Okay, it consists of only connective tissue. It does not contain any blood vessels or nerves. Okay, it does not consist any blood vessels and nerves. Okay, so this median incision. So a median incision through linea alba is common for surgical approach. Okay, for the surgical approach, this linea alba is used for incision. Okay, while doing the operations. Okay, this is about the linea alba. It will be extends from the tip of the xiphoid process to upper surface of the pubic symphysis. Okay, it does not contain any nerves or blood vessels. Okay, it is useful for the. It is a main. It is a medium incision through linea alba is common for surgical approach. Okay, next coming to the linea semilunaris. Okay, where you had seen the linea semilunaris, this is the linea semilunaris. Okay, it will be extends from the pubic tubercle. Okay, it will be extends from the pubic tubercle. Okay, it will be extends from the pubic tubercle, will be extends upwards. Okay, up to the tip of the ninth costal cartilage. Up to the tip of the ninth costal cartilage, this linea semilunaris will be extends. Okay, okay, this linea semilunaris, which will be forms a lateral border for the rectus abdominis muscle. See, this is the rectus abdominis muscle. Okay, this is the real cadaver picture. See here, this is the rectus abdominis muscle. This is the linea alba. Okay, this is the linea semilunaris. This one is the linea semilunaris. Extends from the pubic tubercle to tip of the ninth costal cartilage. Okay, this is the rectus abdominis muscle. Okay, lateral border of the rectus abdominis muscle, which will be forms the linea semilunaris, is the site for the linea semilunaris. Okay, see, this is a intertendinous sections we had seen in the previous slides. Okay, this is the intertendinous section in between the strips of the rectus abdominis muscle. Okay, this is one, and this is one intertendinous sections. Okay, and next, see, this is the hip bone. Okay, this is the hip bone. Entire this picture is called as a pelvis. We know the difference between the hip bone and pelvis. Pelvis is nothing but two hip bones along with sacrum is called as a pelvis. Okay, one single bone is called as a hip bone. Okay, this hip bone consists of three parts. Hip bone is formed by three parts. What are the three parts? Ilium, pubis, and ischium. See, this is the ilium, this is the pubis, and this is the ischium. Okay. See, this is the pubis bone. Okay. This is the body of the pubis, and the body of the pubis, and this is the superior ramus, and this is the inferior ramus of the body of the pubis. Okay. Body of the pubis, superior ramus, and inferior ramus. The upper border of the body of the pubis, upper border of the body of the pubis is called as a pubic crest. See, what is pubic crest? The rounded upper or superior border of the body of the pubis is called as a pubic crest. Okay, what is the importance of the pubic crest? It will be gives attachment to the anterior abdominal muscles and some tendons get inserted in the upper surface of the body of the pubis. Okay, it is called as a pubic crest, which is rounded. Okay, where it is present, it will be present just lateral to the pubic symphysis. Where it is present, it will be just lateral to the upper part of the pubic symphysis. See, this is the pubic crust. Okay, whereas which will be like medial to the pubic tubercle. Okay, the pubic crust which will be ends as a tubercle. Tubercle is nothing but a small elevation. Okay, the lateral end of the pubic crust is called as a pubic tubercle. This is the pubic tubercle. See, this is the pubic tubercle and this is the pubic crust. Pubic crust is nothing but upper border of the body of the pubic crust. Okay, upper surface of the body of the pubis is called as a pubic crust. The lateral end of the pubic crust is called as a pubic tubercle. This is the pubic tubercle. What is pubic tubercle? The lateral end of the pubic tubercle is called pubic crust is called as a pubic tubercle. Okay. What is the attachment for the pubic tubercle? What is the attachment for the pubic tubercle? It will be gives attachment for the inguinal ligament. Okay. Main important structure. It will be gives attachment. It will be gives attachment for the inguinal ligament. Medial end of the inguinal ligament will be get inserted at the pubic tubercle. Okay. This is about the pubic crust and pubic tubercle. And next we are going to discuss about the anterior superior iliac spine. This is the ilium bone. Okay, this is the ilium bone. This is the anterior superior iliac spine, and this is the anterior inferior iliac spine. Okay, and next this is the posterior superior iliac spine. Okay, in between the anterior superior iliac spine and posterior superior iliac spine, the expanded plate-like crust is called as the iliac crust. This is the iliac crust. Okay, these are the important bony landmarks. Okay, you should know while doing the dissection or while doing the operations. You should know the important landmarks. Okay, so this is the anterior superior iliac spine, and this is the posterior superior iliac spine, and this is the iliac crust. Okay, this is the iliac crust. Okay, this is in the just 4 to 5 centimeters behind the anterior superior iliac spine. This is called as a pubic tubercle. Sorry, iliac tubercle, not pubic tubercle. For iliac tubercle. Okay, this is the iliac tubercle. Okay, where you are going to see the iliac tubercle on the iliac crust. You are going to see the iliac tubercle. Okay, this is the anterior superior iliac spine. This is the iliac crust, and this is the posterior superior iliac spine. Okay, this is the anterior inferior iliac spine. What is the attachment of the inguinal ligament? Okay, what is the attachment of the inguinal ligament? It will be gives attachment to the anterior superior iliac spine to pubic tubercle. Lateral end of inguinal ligament will be get inserted to the anterior superior iliac spine, whereas medial end of the inguinal ligament will be gets inserted into the pubic tubercle. What is inguinal ligament? Inguinal ligament is nothing but the aponeurosis of the external oblique aponeurosis muscle. It is one of the anterior abdominal muscle. Okay, the lower part of the external oblique aponeurosis muscle will be forms as a aponeurosis, which will be turns backwards. The lower part of the external oblique aponeurosis will be folded backwards, and it will be forms as a thick ligament. Okay, this ligament is called as a inguinal ligament. Its lateral end will be inserted into the attaches to the anterior superior iliac spine, where medial end is attaches to the pubic tubercle. Okay, what are the important muscle we get inserted into the anterior superior iliac spine? Sartorius. Sartorius is also one of the important thigh muscle. Okay, this inguinal ligament and anterior sartorius muscle will be gets inserted into the anterior superior iliac spine. Okay, this is the iliac crust. Where it is present? It is present between the anterior superior iliac spine and posterior superior iliac spine. This is the iliac crust. Okay, these are the bony important landmark. You should take the palpation. Okay, next, how the abdomen and pelvis is divided into 9 regions. Okay, abdomen is divided into either in 9 regions or into 4 regions. Okay, it will be divided into 4 quadrants or 9 regions. We are going to discuss about the 9 regions by 2 vertical planes and 2 horizontal planes. Okay, it will be divided into 2 vertical planes and 2 horizontal planes. Okay. See, this is a lateral plane, right and left lateral planes. This is the right and left lateral planes. From where the lateral planes will be extends. This lateral plane will be extends from the mid-inguinal point. Mid-inguinal point means it will be extend from the anterior superior iliac spine to pubic tubercle. Okay, this is a mid-inguinal point. Okay, it will be extends from the mid-inguinal point to mid-clavicular line. This is the right lateral plane and this is the left lateral plane. This is the right lateral plane and this is the left lateral plane. Okay, these lateral planes which will be extends from the mid-clavicular line to mid-inguinal point. Mid-inguinal point. Okay, these are the two lateral planes, okay, right and left lateral planes, which will be extends from the mid-inguinal point to mid-clavicular line. Okay. Next, coming to the horizontal planes. Okay, these are the two horizontal planes. You forgot about the subcostal plane here. Okay. Next, here we are going to see two horizontal planes. These are the two horizontal planes. One is transpyloric plane and one is transtubercular plane. Okay, transpyloric plane and transtubercular plane. Where we are going to draw the transpyloric plane. Okay, transpyloric plane. It's junction between the suprasternal notch to pubic symphysis. It is a junction between the suprasternal notch to pubic symphysis. Okay, it is a midway or it is a midpoint between the suprasternal notch to pubic symphysis. Okay, here you should keep one point for the transpyloric plane. Okay, and next it will be drawn, whereas either it will be drawn from suprasternal notch to pubic symphysis or a junction between the xiphoid process and umbilicus. We should draw a line. This line is called as a transpyloric plane. Okay, it will be extends from the tip of the ninth costal cartilage. Okay, it will be extends on either side from tip of the ninth costal cartilages. Okay, in front, whereas behind it will be reaches at the level of upper border, lower border of the L1 vertebra. Okay, in front it will be a line will be extends from the tip of the ninth costal cartilage and junction between the suprasternal notch and upper surface of the body of the pelvis, or from the xiphoid process to umbilicus. A point will be drawn. Okay, this is the transpyloric plane. Okay, behind it will be process at the level of lower border of L1 vertebra. First lumbar vertebra. Okay, this is the side where you should draw the transpyloric plane. Okay, what is the importance of the transpyloric plane? Here, some important structures will be passes at this level. Okay, uh, uh, pyloric orifice is present at this level, whereas superior mesenteric artery will takes origin at the pyloric plane, whereas next fundus of the gallbladder will be lies at this level. Okay, and next hilum of the kidney will be lies at this level. Okay, all these are the important structures which will be processed through this transpyloric plane, where you are going to draw the transpyloric plane at the junction between the suprasternal notch or pubic symphysis or xiphoid process or umbilicus. Okay, this is one point, and next point at the tip of the ninth costal cartilages on the costal margin. Okay, you should draw one more line. Okay, behind it will be drawn at the lower border of the L1 vertebra. Okay, this is a transpyloric plane. Okay, and next we are discussing about the intertubercular plane or transtubercular plane. Okay, intertubercular plane or transtubercular plane. Okay, where you are going to draw this transtubercular or intertubercular plane. A horizontal line passes through the tubercle of the iliac crest. Already we had seen in the previous slide. So this is the tubercle of the iliac crest. Okay, see, a line will be drawn from the tubercle of the iliac crest. Okay, both the tubercles of the iliac crest will be joined together and forms a intertubercular plane. Okay, this is about the intertubercular plane. Okay, where at which level this intertubercular plane will be lies at the upper border of the fifth lumbar vertebra. At the upper border of the fifth lumbar vertebra, this intertubercular plane will be lies at the upper border of the fifth lumbar vertebra. Okay, this is about the horizontal planes and vertical planes. Okay, next coming to the subcostal plane. Okay, this is the subcostal plane. How we are going to draw the subcostal plane? At the tip of the costal margin. See, this is the tip of the costal margin. Here we should draw it. We should join these two tips of the 10th costal margin. This is the side for the subcostal plane. Okay, this is the side for the subcostal plane. Where it will be lies? It will be lies at the level of upper border of L3 vertebra. Where it will be lies? It will be lies at the level of upper border of the L3 vertebra. Transpyloric plane will be lies at the level of L1, whereas subcostal plane will be lies at the level of L3, whereas intertubercular plane will be lies at the level of L5. L5. Okay. Next, supracrustal plane. Supracrustal plane is also nothing but highest point of the iliac crust. The line will be joins the highest point of the iliac crust. Okay, this will be lies at the level of upper border of the L4 vertebra, fourth lumbar vertebra. So, what is the arrangement for these planes? L1. L1 will be lies at the level of transpyloric plane. Okay, transpyloric plane will be lies at the level of L1 vertebra, whereas subcostal plane will be lies at the level of L3 vertebra, whereas supracrustal plane will be lies at the level of L4 vertebra, whereas intertubercular plane will be lies at the level of L5 vertebra. These are all the important planes present in the abdomen. It will be divided into divisions. Okay. See, this is the right and left vertical planes, and these are the horizontal plane. This is the uh, transpyloric plane, and this is the transtubercular plane. Okay, this is the transpyloric plane, and this is the transtubercular plane. By these four planes, two vertical planes and two horizontal planes, this abdomen is divided into 9 divisions. This abdomen is divided into 9 divisions. Okay. First, we are going to discuss about the medial plane. Okay, in the medial plane, from above downwards, this is the epigastric region. Okay, this is the umbilical region, and this is the hypogastric region. Okay, this is a hypogastric region. On either side, okay, on either side, we are going to see from above downwards. This is the right hypochondric region, and this is the right lumbar region, and this is the right iliac region or inguinal region. Okay, whereas on the left side, left hypochondric region, left lumbar region, and left iliac or inguinal regions. This way, the abdomen is divided into 9 regions by two horizontal planes and two vertical planes. Okay, vertical planes will be extends from the pubic tubercle to mid clavicular line. Okay, whereas this transpyloric plane will be lies at the junction between the suprasternal notch to pubic symphysis, or a junction between the xiphoid process to umbilicus. Okay, this is the side, and next the tip of the 9 costal cartilages will be joints. Okay, this is the site where the transpyloric plane will be drawn in front, behind by the lower border of the first lumbar vertebra. Okay, this is the site we should draw the transpyloric plane. Okay, and next transtubercular plane, we should draw a horizontal line drawing the tubercles of the iliac crust, joins the tubercles of the iliac crust. This is a transtubercular plane, which will be lies at the level of L5 vertebra, which will be lies at the level of L5 vertebra. Okay, these are all the 9 regions. How it will be divided into 4 quadrants. How it will be divided into 4 quadrants. By a median plane, okay, median plane which will be extends from the xiphoid process to upper border or upper border of the pubic symphysis. This is a median plane. Okay, and next a horizontal line will be drawn at the level of the umbilicus. A horizontal line will be drawn at the level of the umbilical region. Okay, so this is a upper right quadrant, and this is the upper left quadrant. And next, this is the lower right quadrant, and this is the lower left quadrant. This like the abdomen is divided into 4 quadrants. Okay. See, this is the regions. Okay. What are the structures present in these regions? You should see. Okay. Next important thing here is already we had discussed about the inguinal ligament. Inguinal ligament is nothing but it is a lower part of the, it is the aponeurosis formed by the external oblique muscle. Okay, it is a aponeurosis. It can together forms a inguinal ligament. Okay, this lateral end will be attached to the anterior superior iliac spine, whereas its medial end will be attached to the pubic tubercle. Okay, this is the inguinal ligament. Okay. Here we are going to discuss about the inguinal canal. What is inguinal canal? Okay, this is a inguinal canal. Okay, this inguinal canal is nothing but it consists of where it is present. It is present just above or 1 centimeter above to the medial end of the inguinal ligament. Okay, this inguinal canal will be parallel with the medial end of the inguinal ligament. Okay, medial half of the inguinal ligament will be parallel with the inguinal canal. Medial half of the inguinal ligament, which will be parallel with the inguinal canal. Okay. How this inguinal canal is formed? How this inguinal canal is formed? Inguinal canal is formed by 2 rings. This is the deep inguinal ring, and this is the superficial inguinal ring. Okay. This is the deep inguinal ring. This is the deep inguinal ring, and this is the superficial inguinal ring. Where you should draw the deep inguinal ring. Okay, just 1.2 centimeters above the mid inguinal point. Okay, just about 1.2 centimeters above the mid inguinal point, you should draw a ring. This ring is called as a deep inguinal ring. Where we are going to see this deep inguinal ring, it will be seen in the fascia transversalis. Okay, it is formed by the fascia transversalis. Okay, which will be invasinates. This inguinal canal will be invasinates through this fascia transversalis. Okay, which will be covers the covering of the spermatic cord. Okay, what are the structures present in this inguinal canal or spermatic cord, ilioinguinal? No, all these structures will be present in the inguinal canal. Okay, spermatic cord in males, whereas round ligament of the uterus in females. Okay, where you are going to see the deep inguinal ring in the fascia transversalis. Okay, where this deep inguinal ring is present just 1.25 centimeters above the mid inguinal ligament, you are going to see the deep inguinal ring. Okay, next coming to the superficial inguinal ring is the where you are going to see the superficial inguinal ring 1 centimeter above and just lateral to the pubic tubercle. You are going to see the superficial inguinal ring. Okay, where you are going to see the superficial inguinal ring 1 centimeter above and lateral to pubic tubercle. See, this is the pubic crest and this is the pubic tubercle. 1 centimeter above and lateral to pubic tubercle. You are going to see the deep superficial inguinal ring. Okay, this inguinal canal extends from the deep inguinal ring to superficial inguinal ring. Okay, what is the extension of the inguinal canal? It will be extends from the superficial deep inguinal ring to superficial inguinal ring. Okay, what is the length of the inguinal canal? It will be, its length is nearly 3.5 to 4 centimeters in length. Okay, its length is nearly 3.5 to 4 centimeters in length, where it is present just parallel to the medial half of the inguinal ligament, just medial to medial, just above the medial half of the inguinal ligament. It is present. Inguinal canal is present. Okay. Where we are going to see this superficial inguinal ring in the external oblique aponeurosis. Your external oblique aponeurosis muscle, you are going to see the superficial inguinal ring. whereas deep inguinal ring will be seen in the facial transversalis. Okay, whereas deep inguinal ring is somewhat deep when compared to the superficial inguinal ring. Okay, this is about the inguinal ligament, inguinal canal, deep inguinal ring, and superficial inguinal ring. Okay, these are the important landmarks you should know while doing the surgery or dissection. Okay, next coming to the mid-inguinal point and midpoint of inguinal ligament. What is mid-inguinal point and midpoint of the inguinal ligament? See, this is the anterior superior iliac spine. Okay, this is a pubic, this is a pubic tubercle. This is a pubic crest. Okay, this is a pubic symphysis. Okay, from anterior superior iliac spine to pubic symphysis. Junction between the anterior superior iliac spine to pubic symphysis. This point, middle point, is called as a mid-inguinal point. Okay, junction between the anterior superior iliac spine to pubic symphysis. Okay, this point is called as a mid-inguinal point. What is midpoint of the inguinal ligament? Midpoint of the inguinal ligament means a junction between the anterior superior iliac spine to pubic tubercle. Okay, this is the attachment for the inguinal ligament. Okay, so the midpoint of the inguinal ligament is called as a midpoint of the inguinal ligament. Okay, this is the difference between the mid-inguinal point and midpoint of the inguinal ligament. You should not be confused here. Okay, this is the midpoint of the inguinal ligament and this is a mid-inguinal ligament. Okay, midpoint of the inguinal ligament and mid-inguinal point. Okay, midpoint of inguinal ligament which will be related for the femoral artery. Okay, this is the side where we are going to feel the femoral artery. Okay, next coming to the neck bones point. Okay, this is also one of the important structure you are going to see here. Okay, where what is neck bones point? On the right side of the on the on the right side, the line will be extends from the right anterior superior iliac spine to umbilicus. Okay, a line will be drawn from the anterior superior iliac spine to umbilicus. Okay, it will this line will be divided into medial two-third and lateral one-third. This line will be divided into medial two-third and lateral one-third. This point is called as a Megman's point. Okay, this point is called as a Megman's point. Okay, this point will be corresponds to locate the base of the appendix. Okay, this side is corresponds with the location of the base of the appendix is present here. Okay, see here it represents the maximum tenderness. Why? In inflammation of the appendix. In the inflammation of the appendicitis. Okay, inflammation of the appendix is called as a appendicitis. When we feel the pain of the appendix, here the pain, tenderness of the pain, maximum tenderness of the pain will occurs in this right iliac fossa, at junction between the medial two-third and lateral one-third, between anterior superior iliac spine to umbilicus. Okay, this is the side we feel the Megman's point. Okay, this is the side you should feel the pain of tenderness during appendicitis. Okay, next coming to the fundus of the gallbladder, where we are going to see the fundus of the gallbladder. See, this is the fundus of the gallbladder. Okay, where you had seen this fundus of the gallbladder in the lower border of the in the lower margin of the liver, you had seen this fundus of the gallbladder. Okay, how you should point out for this? Okay, this will be, this is the transpyloric plane. Okay, this is a transpyloric plane. There you had this. What are the important structures passes through this transpyloric plane? One is the fundus of the stomach. Okay, rest of the things you had seen. What are the next steps? Important structures: origin of the superior mesenteric artery and next hilum, whereas pylorus of the stomach will be lies at this levels. Okay, whereas this spinal cord will be terminates at this level. Okay, see This is the fundus of the stomach. Okay, where we are going to see the fundus of the stomach in the inferior margin or lower border of the liver. We had seen the fundus of the stomach. Okay, see, a lower border represents a slight notch opposite to the tip of the ninth costal cartilage. It is also an important one. At the tip of the ninth costal cartilage, you had seen the fundus of the stomach. Okay, that is an intersection between the right vertical plane and transpyloric. Okay, here also you are going to see the fundus of the stomach, the fundus of the gallbladder. Okay, this is the site you are going to at the tip of the ninth costal cartilage or at the intersection between the right lateral plane and transpyloric plane. Here also you are going to identify the tip of the here you are going to see the fundus of the gallbladder. Okay. Next, Murphy's point. Murphy's point. Okay. How you should see the Murphy's point. How you should examine. Okay. The examiner should place the hand below the right costal margin. Below the right costal margin. In the mid-clavicular line. In the mid-clavicular line. See, this is the mid-clavicular line. This is the right costal margin. Here you should place the hand below the costal margins. You should feel. Okay, below the costal margin, right costal margin, you should feel the Murphy's point. Okay, here you should feel the cholecystitis. Cholecystitis is nothing but inflammation of the gallbladder. Inflammation of the gallbladder is known as the cholecystitis. Okay, this is about the Murphy's. Next, ileocecal orifice. Ileocecal orifice, where you are going to point out the ileocecal orifice. Okay, intersection point between the right lateral plane and trans or intertubercular plane. This point is for the ileocecal orifice. Here, this ileocecal orifice is present. Okay, where you are going to see the ileocecal orifice, intersection point between the right lateral plane and transtubercular plane. This is the site where you are going to see the ileocecal orifice. Okay. This is about the general external points for the surface anatomy of the abdomen. Okay. How the abdomen is divided into 9 regions by 2 vertical planes and 2 horizontal planes. Okay. By these planes, by these planes, the abdomen is totally divided into 9 regions. Okay. In these 9 regions, what are the organs and what are the structures present? Okay. We will discuss in the next class. Okay. What are the organs and structures present in these 9 regions? Okay. We will discuss in the next class tomorrow. Okay. This is about the surface markings of the abdomen. Okay, mainly you should know about these things. Okay, mainly you should know about the xiphoid process, costal margins. Okay, right and left costal margins, and mainly the tip of the ninth costal cartilage you should feel. Okay, you should feel the tip of the ninth costal cartilage. Okay, here you should try a transpyloric line. Okay, and next this is the ilia tubercle, and this is the anterior superior iliac spine. Okay, this is the inguinal ligament. Okay, this is the pubic tubercle, pubic crest, pubic symphysis. What is pubic symphysis? Pubic symphysis is nothing but it is a secondary cartilaginous joint. Okay, it is a secondary cartilaginous joint. Okay, this is the linea alba. This is the linea alba, and this is the linea semilunaris. Okay, here you are going to see the rectus abdominis muscle in the rectus abdominis muscle. Okay, in between the parts of the rectus abdominis muscle, you are going to see tendinous intersections. These are the tendinous intersections. Okay, this is the linea semilunaris, which will be extends from the pubic tubercle to tip of the ninth costal cartilage. Okay, which will be represents the lateral border of the rectus abdominis muscle. Median border of the rectus abdominis muscle will be represents the linea alba. What is linea alba? Linea alba is nothing but it is a fibrous wrapping which will be extends from the tip of the xiphoid process, tip of the xiphoid process to upper surface of the pubic symphysis. Okay, it does not consist of any blood vessels. Okay, any blood vessels are not. So, median incision will be given for the abdominal operations. Okay, abdominal surgeries. Okay, these are the main important palpable structures which will be seen in the anterior